Bonjour, good afternoon. I want to start off by outlining a couple of things. First off, we saw yesterday that New Democrats are the only party in the House committed to removing profit from long-term care, something that all experts agree and all the evidence makes very clear. For-profit care in long-term care has made worse conditions for seniors and has meant they're more likely to get sick and with deadlier infections. And it's clear, again, that the Liberals, the Conservatives, and the Bloc all are on the side of for-profit long-term care providers, while New Democrats are on the side of people, of our loved ones, of seniors. Also, we now have seen a date for the budget. With the budget, we want to see three clear things. First off, we want to see a priority on making sure all Canadians are vaccinated, all hands on deck approach to get everyone in our country vaccinated as soon as possible. Secondly, we need help for people. That needs to continue. And the things that the Liberals have promised to do, that includes that includes pharmacare for all, that includes childcare, and additional supports that we were pushing for, which includes dental care. And then thirdly, we want to see a plan that answers the question, who pays for this, the cost of the pandemic and the cost of the recovery. We know that it should not be families, it should not be workers, it shouldn't be small businesses, but we know who it should be. It should be the ultra wealthy, those that have made billions off this pandemic, those at the very top, the wealthiest corporations that make profits in Canada, but don't pay taxes here. They should be the ones that are paying their fair share. So those are some of the things we'd like to see in the budget. Donc, en commençant, je veux dire que hier, on a vu comment les conservateurs, les libéraux et les blocs appuient les entreprises qui donnent qui fournissent les services des soins de longue durée à but lucratif et comment ils veulent protéger leurs profits et comment nous, les démocrates, sont les seuls partis qui défendent les intérêts de nos aînés en proposant l'idée d'enlever les profits des centres de soins de longue durée. C'est clair, il y a beaucoup de preuves qui montrent que les centres de soins de longue durée à but lucratif sont où on a trouvé les pires conditions pour nos aînés et le plus grand nombre de partagés de la COVID-19 et les pires résultats en nombre des morts. On a perdu nos proches. Donc, on est les seuls qui défendent les intérêts des gens. Et finalement, le gouvernement libéral a mentionné, a déclaré la date pour le budget. Dans le budget, on va voir trois choses. Un, priorité pour la vaccination de toute la population en mobilisant tous les ressources fédérales pour vacciner toute la population. Deuxièmement, l'appui pour les gens et les promis que le gouvernement libéral a déjà fait, comme une assurance médicaments universelle et deuxièmement, un système de garde universel. Donc, ce sont des choses qu'ils ont déjà promis. Aussi des autres appuis comme des soins dentaires, comme on a proposé. Et finalement, la grande question, qui va payer la facture pour la relance et pour la pandémie? On était clair et on va continuer d'être clair. Ce n'est pas les travailleurs et les travailleuses, les petites entreprises qui doivent payer la facture, mais c'est les ultra riches qui ont gagné des milliards de dollars, les grandes entreprises qui ont gagné des records, des profits records. C'est eux qui doivent payer le juste part et on va continuer de pousser pour ça. Donc, ce sont les trois choses qu'on veut voir. With that, I am ready to take any questions you might have. Merci et je suis prêt pour vos questions.
Nous allons maintenant prendre les questions, commençant par les questions au téléphone. Un rappel aux journalistes, une question de suivi comme à l'habitude. We'll now take questions, starting with questions on the phone. Quick reminder to reporters, one question, one follow-up as usual. Opératrice, avons-nous une première question?
Oui, merci. La première question est de Man Al-Midi of the Canadian Press. Please proceed. Your line is now open.
Hello, Mr. Singh.
Hello, sir.
How are you?
Good.
So you have said in the past that you want to get an election until a sufficient number of Canadians are vaccinated. Presuming that that vaccination threshold has not been yet reached or won't be reached when it comes time to vote on the federal budget, it's going to be tabled next month. Is it likely that the NDP will support the budget because of this?
Thank you for the question. we have said very clearly that we do not want to find ways to tear down government, that we want to make government work for people. We want to make Parliament work for people. So we will not be looking for ways to vote against the budget. What we will be doing is what we've done throughout this pandemic, is fighting for the help that people need, and the help that we were able to deliver in the past got families enough money to put food on the table. We're able to give financial support to students. We were able to keep people employed by making sure the government covered a portion of their salary to keep people employed. And we were able to get paid sick leave in place for workers. So these are the types of things that we want to continue to fight for, the help that people need.
But yeah, as a follow-up, you mentioned in the beginning today that there are 3 issues that you want to see in the budget. Say, if the Liberals don't commit to these issues, to these points that you are asking for, would you still support the budget to avoid an election during COVID pandemic?
Yeah, it's really clear that the Liberals want an election, and we are really clear that we want to help people. And that's been really clear. So we are going to continue to make that message clear to the Liberal Party government. We want to see help for people. We want to see vaccinations as a priority. And there's promises that they've made to Canadians. So if they break their promise yet again on universal pharmacare, something they campaigned on, they promised in the last election. If they break that promise in this budget, if there's no commitment to that, they've got to answer to Canadians. They broke that promise to them. If they break their promise again on childcare, that's another promise they've broken to Canadians. They'll have to answer to Canadians. But we're really clear. Our goal is to fight for people, to make Parliament work, and we are not looking for, right now, especially during this pandemic, we're not looking for ways to tear down government. We are trying to find ways to get Parliament to work for people, and most importantly, to get everyone vaccinated. That has to be the priority right now, not going to an election, which it seems like Justin Trudeau has made it clear that's his priority. It's not our priority. Our priority is people.
Operator, next question.
Thank you. Merci. The next question, la question suivante est de Louis Blouin de Radio-Canada. La parole est à vous.
Bonjour, M. Singh.
Bonjour.
Je veux revenir sur la question, l'affaire Ataran. Vous ne demandez pas à votre député, M. Green, de retirer ses propos, de s'excuser. Ne pensez-vous pas que ça envoie un drôle de signal aux Québécois? Est-ce que ça peut nuire à vos chances au Québec, cette affaire-là?
On était clairs et nos députés sont clairs, tous nos députés sont clairs. On rejette absolument l'idée que tous les Québécois et Québécois sont racistes. C'est fausse. On était clairs, tous nos députés sont clairs. Et pour la question qu'est-ce qu'on peut faire pour les Québécois et Québécoises et dans la prochaine élection, nous étions le seul parti d'opposition qui a réussi à faire aucune chose pour aider, pour faire quelque chose pour aider les familles. Les autres partis, les blocs, les conservateurs ont fait aucune chose de concret pour améliorer les conditions des familles au Québec. C'était nous qui ont doublé la PCE. C'était nous qui ont livré l'aide aux étudiants. C'était nous qui ont augmenté la subvention salariale. C'était nous qui ont mis en œuvre un programme de congés de maladie payés. Donc, pour les Québécois et Québécoises, c'était nous, les néo-démocrates, qui a amélioré la condition de leur vie. Et on va continuer de se battre pour les Québécois et Québécoises. On va continuer de défendre la langue française et de défendre leurs intérêts, comme on a déjà montré avec des exemples concrets.
Bon, j'aimerais quand même ça peut-être vous entendre à savoir, vous ne pensez pas que ça peut laisser une drôle d'impression aux Québécois, mais par ailleurs, j'aimerais ça vous entendre sur l'approvisionnement en vaccins. On voit des soubresauts avec l'Inde et l'Europe. Est-ce que vous êtes inquiet pour l'approvisionnement en vaccins et quelle clarification peut-être aimeriez-vous avoir du gouvernement actuellement?
J'ai des bonnes craintes, j'ai des grandes craintes et des inquiétudes qui sont basées sur la réalité que le gouvernement libéral a échoué dans ce dossier. C'est clair que c'était un échec parce que la priorité devrait être d'avoir la capacité de produire les vaccins chez nous. Et c'était une grande erreur que le gouvernement libéral a fait. Le fait qu'une année avant, ils n'ont pas pris les mesures nécessaires de créer la capacité ici au Canada. Et on va être toujours dans cette même situation où, à cause des logistiques internationales, il y a un manque des doses de vaccins. Donc, dans la question de la sécurisation des vaccins, c'était un échec du gouvernement libéral et ça me rend triste parce que je veux que la vaccination réussisse et je vais continuer de mettre la pression pour qu'elle puisse réussir. Sure, just in English on that. I think that was your follow-up anyways. With respects to the securing of doses, this is a failure of the Liberal government. And it's something that I'm very sad about because I want the vaccination to succeed. But it is clear that the Liberal government failed one key priority, which is to make sure we had the local capacity to produce the vaccine. And as long as we don't have that ability to produce it locally, we will always be at the whims of international logistics and potential delays and shortfalls in shipments of vaccine. So what we've said in the beginning is we need to be able to produce the vaccine locally. We need to, in fact, own that production like we used to in the past with Connaught Laboratories. We want to reinstate that publicly owned ability to produce vaccines and critical drugs in our country. This pandemic has shown that it's vital, and the delays with international shipments has shown how crucial it is for our own sovereignty that we are able to produce these locally. And this has been one of the Liberal government's biggest failures.
Opératrice, prochaine question.
Merci. Thank you. The next question, la question suivante est de Marie Vastel du Devoir. La parole est à vous. Please proceed.
Oui, bonjour, M. Singh. J'aimerais revenir sur la première question de mon collègue sur les propos du professeur Attaran, mais aussi ceux du député Matthew Green sur Twitter. Êtes-vous toujours à l'aise avec les commentaires de M. Green ou est-ce que vous avez changé d'avis avec les retombées qu'il y a eu là, depuis hier dans ce dossier-là?
Donc, comme j'ai dit, tous nos députés, tous les députés néo-démocrates rejettent l'idée complètement que tous les Québécois sont racistes. C'est fausse, c'est une idée qu'on rejette complètement. On a un problème dans tous les pays de racisme systémique et on veut faire face à ce problème ensemble. On peut seulement régler ce problème en travaillant ensemble. Et il y a plusieurs personnes à travers le pays, incluant le Québec, où on a des militants qui mobilisent et militent pour éliminer le racisme systémique. Et on est fiers du travail que les militants font et on est d'accord que c'est un problème qui existe à travers le pays et c'est un problème qu'on doit régler ensemble. Just on English on that last question, and then I'll come en anglais, et puis je vais retourner à votre suivi. So all of our New Democratic MPs are together, united in rejecting the idea completely that all Quebecers are racist. We reject that. That is false. There is a problem of systemic racism that exists across the country, and we need to address that. We need to solve that problem. And there are incredible activists that are working across the country, including in Quebec, who are fighting against systemic racism because it hurts all of us. And we are proud of that work that's going on, but there's a lot more that we need to do. And the only way we can deal with systemic racism is coming together to solve this problem, to tackle it, and to dismantle it.
Suivi?
En suivi, j'aimerais savoir, est-ce que vous avez parlé à Alexandre Boulris depuis lundi? C'est votre seul député québécois. Est-ce que vous lui avez parlé depuis le tweet de M. Green? Est-ce que vous lui avez parlé hier? Et est-ce qu'il est aussi à l'aise que vous avec cette décision-là de ne pas réclamer d'excuses à Matthew Green?
On a eu une rencontre de caucus aujourd'hui. Donc oui, toute notre équipe, on a parlé de ce sujet et on a unifié comme tous les partis, tous les néo-démocrates, tous les députés, on est ensemble en rejetant l'idée complètement que tous les Québécois sont racistes. C'est fausse, on est contre ça. C'était jamais dit, c'était jamais l'idée. Et c'est une idée qu'on rejette complètement. Nous, les néo-démocrates, on défendu la langue française. On a montré comment on a appuyé les familles au Québec. On a aidé les Québécois et Québécoises. On est fiers de notre travail de doubler la PCU, de donner l'aide aux étudiants, d'augmenter la subvention salariale, de mettre en place un congé de maladie payé. Tous ces programmes, toutes ces étapes ont vraiment concrètement amélioré les vies des Québécois et Québécoises. On était la seule partie au Parlement qui a réussi à faire aucune chose pour aider les familles. Les conservateurs, les blocs, on fait rien pour aider les familles concrètement. On fait rien pour avancer, aucune politique pour améliorer les vies des Québécois et Québécoises. C'était nous, la seule partie en opposition qui a fait ça. Et on va continuer de se battre pour les Québécois et Québécoises et pour tout le Canada.
Et nous allons maintenant prendre les questions dans la salle. We'll now take questions from the room. David?
Hi, Mr. Singh. I want to come back to
Sure.
Mr. Green's comments. And I have to ask, what's wrong with calling a province, a country, racist? Because I've heard it said quite often that that's how some people, Canadians, would describe this country. And they would say that doing such is not something hateful. It's probably very Canadian. It's a patriotic thing to do, to call out the failures and the shortcomings of our country. So I'm just wondering, can you explain to us, why is it wrong to call a province racist?
So I think it's a very important question. I want to clarify a couple of things. To single out one province when we live in a country that is rife with systemic racism is just not true. All provinces have massive problems with systemic racism. Our country at the federal level has massive problems with systemic racism. We've got numerous examples, but let's look at the treatment of Indigenous people as a clear example of systemic racism and white supremacy. There is no way that there would ever be a problem of drinking water in a major city. We're in Ottawa today. That wouldn't be solved immediately, that the federal government, provincial governments, municipal levels of government, everyone would jump into action to make sure Ottawa had clean drinking water. That would apply for any major city. But when it comes to Indigenous people, they don't get that help. So the systemic racism that exists, it would be wrong to characterize it as being a problem for one particular city or province. It is a problem for all of Canada, and people are faced that. Right now, anti-Asian racism is impacting people in Vancouver to a massive degree. Carding, one of the worst practices when it came to stopping racialized people, was most prevalent in Toronto, one of the most diverse cities. So it's important that we say, yes, systemic racism exists. It exists everywhere in Canada. We all have a responsibility to fight it, and we shouldn't shy away from that. But to single out one province is just not true. It's something that exists everywhere.
Okay, so you are making your priorities clear of what you would like to see in the budget. What happens if you don't get it, if you don't get those things?
Very important question. I want to just again reiterate, for us right now, we have been very clear that our priority is to get everyone vaccinated. That is the goal. That is the priority. That should be the priority of the government as well. We know that the variants are spreading, people are worried, and the vaccine is really our ticket out of this in a lot of ways. There's many things we need to do, but that's one of the things that as soon as our loved ones are vaccinated, I know I'm worried about my parents all the time, and I wonder, as soon as they get the vaccine, I'll be able to breathe a bit of relief knowing that they're okay and they're not going to get sick. And if I ended up getting COVID-19, I'm not going to put my parents at risk. That's really, for a lot of Canadians, an important moment. The thought that the Liberal government would play a game and try to make an election happen at a time when we need to get everyone vaccinated is wrong. And I've been clear that, sure, things are looking good for our party. We're in a good position. Maybe people are saying that we're going to gain seats. That doesn't matter to me. I'm not trying to game what's better for the party when we know that vaccination is the most important thing right now. And I'm focused on that. So because of that, I don't want to find a way to tear down government. I want to find a way to make Parliament work for people. Now, if the Liberals break their promises again, they're going to have to answer to Canadians. They promised pharmacare to Canadians. If they break that promise, they're going to have to answer that to Canadians. If they break their promise on childcare, they're going to have to answer that question to Canadians. If they break their promises, it's ultimately not to me. I want them to do things because it's in the interest of Canadians. But really, at the end of the day, their broken promises hurt Canadians. It's people that get hurt by it. So those are the people they're going to have to be accountable to. We're going to fight right now, and our priority is right now to make sure everyone's vaccinated and use whatever position we have and platform we have to fight for the things that Canadians need.
But there'll be no consequences from the NDP.
Right now, our priority is to get everyone vaccinated, not to go to an election.
Mike?
Mr. Singh, Mike Couture with Global National.
Mike,
Thanks for
good to
taking
see
our
you.
questions. Global News learned yesterday that the Navy shut down an internal probe into alleged sexual misconduct by senior officers before all witnesses or complainants were interviewed. Defense Minister Harjit Sajjan says he has concerns about this and has asked the acting defense chief to review how the investigation was conducted. Does that go far enough in your view?
Not at all. Like this is, it's getting to a point of just, it's getting a bit ridiculous. Like if you're looking at all the things that are happening, we've got ombudsman coming forward with clear evidence, and it looks like nothing happens. We've got evidence that complaints were raised, and then the chief of defense was then contract extended or bonus is given. Right now, I think about what this message sends to women in the Canadian Forces. Women who have enough courage, because it takes incredible courage to do this. It's so hard to come forward. They come forward with a complaint. It makes it to the highest levels. Nothing gets done. And now reports that an investigation was cut short before all the witnesses were heard from. There is a clear systemic failure, and the Liberal government is in power and has overseen a lot of this and has not taken enough action. This is deeply problematic, and Justin Trudeau needs to answer these questions. Why doesn't he care about the safety of women in the Canadian Forces? Why is he letting this happen? What steps is he going to take to fix this?
So as a follow-up, in light of the reporting that we've been doing, should the military have an independent watchdog that reports to Parliament instead of what we see now?
Well, I want to be clear. I don't buy for a second that the Prime Minister and the Defense Minister couldn't do a better job. Like they are the ones holding the reins of power right now. They have all the power necessary to hold to account these allegations, to get to the bottom and to investigate. I think it would be a cop out of responsibility if the Liberals come up and say, oh, we're going to appoint somebody independent. Like they're in power. They should be doing this. They have the power to fix these things. And certainly as a move forward, we should look at the best accountability measures possible. And certainly in terms of the way to run a government or run an organization, having the right accountability mechanisms. Other militaries have an independent process, and those things are important. But I just don't want that to shy away from the Liberal government that's in power right now, the defense minister that's in power, who is appointed by Justin Trudeau. They've got the ability to do something. And I don't want it to be lost on folks that they could fix this right now. They have the power to do the right thing. And if it's not happening, it's their fault, not because of a lack of systems of accountability, which we should always look to improve.
Stephanie Levitz, the Canadian Press. Nice to see you.
Good to see you.
Okay, so you're saying that if Trudeau doesn't make good on his promises, he's accountable to Canadians. The focus should be on vaccines. You don't want an election now. It's not safe. What then is your benchmark idea for when an election is okay? I mean, you have the Tories calling for a set of standards, for example, that say, okay, we are now, COVID-free, let's reopen. What are you looking for? What conditions need to exist before, and I'm talking about COVID conditions, not political conditions, where you would say, okay, now we can go ahead and take Canadians to the polls?
The easiest one and the most, I think, obvious one for me would be when everyone's vaccinated. At a starting point, once all Canadians are vaccinated, we know that there won't be that same level of fear and worry and uncertainty. Once we're vaccinated, then we know that people will be less at risk for the worst case of a COVID-19 infection. So I think that would be just a starting point. But even if that happens, for New Democrats, our goal will still be finding ways to make Parliament work for people. Like we're not just waiting for a box to be get checked off and then we're like, all right, we're ready to go to the polls. We were elected to serve people. There's a 4-year mandate usually before elections are held. And we're not chomping at the bit to have an election. Like I said before, we're in a better position than we were in 2019. We'll do better for sure than we did in 2019. But that's not a reason for me to go to an election. I want to continue to find ways to make Parliament work. People sent us here to make it work. They sent us here in a minority government. My priority is to make it work. There might come a time once everyone's vaccinated where Parliament doesn't work. Liberals or Conservatives make it not work, and we've got to make a decision. But my goal will always be to find ways to make Parliament work, to deliver the help that people need. That will always be my goal. But at a minimum, we need to make sure everyone's vaccinated.
Because I only get one follow-up. I'm trying to decide where to go. What do you think of this Tory idea that there do need to be some identifiable data points that are used to govern things like opening the border to the extent that the federal government is in control of anything, when they stop these hotel quarantine measures, that sort of thing? Do you think that that's the way to do it, or how should these things be decided?
Well, my first reaction, anytime we're up against a decision, how we should move forward with anything health related should be consulting public health guidelines and public health advice. That should be our go-to, getting the best advice from health professionals. And the one big risk that we're up against, we know, and that we've been briefed on, is the risk of a mass spread of COVID-19 overwhelming our healthcare system. Lots of Canadians that get sick and can lose their lives. So the vaccination, to me, is the one very concrete metric. Once everyone's vaccinated, we're in a much better position for all discussions, whether it's about reopening and full opening borders, or discussions around whether we need quarantine hotels or not. Again, following public health guidelines and their advice, and making sure everyone's vaccinated. Those are two things I think that we can really couch our decisions around.
And this is all the time we have. Ça, c'est tout le temps qu'on avait. Ceci met fin à la conférence de presse. This concludes the press conference. Thank you.
Merci, thank you.